Before we get to the latest on coronavirus, I just want to start on those tragic stabbings that we've seen in Reading, 3 people losing their lives. Is there any update that you can give us, and could this become a terrorism investigation?
Well, the police are clearly investigating. They have not currently stated that this is a terrorism investigation, but rather a murder investigation. And my heart goes out to the families, the friends of the victims, and clearly it's a shocking event. The police did a brilliant job last night. Firstly, during the event, and then afterwards. And I think it's now an operational matter for the police, and we should give them all of the space and support that they need in order to get to the bottom of it.
Yeah, as you say, a matter for the police now. We'll be bringing you the very latest on that on Sky News just as soon as we get it as well. I want to talk to you now, Health Secretary, about the next steps to easing the lockdown. Can you confirm that from July the 4th, if the infection rate allows, we'll be able to go on holiday in the UK or get a haircut?
Well, we have a clear plan for how we get out of the worst parts of this lockdown safely, and I stress that word safely. It's absolutely critical. We're working through that plan. The plan is so far and currently working. We can see the total number of new transmissions coming down. Thankfully, the number of people dying from coronavirus is coming down. The number of people on ventilated beds in hospital is coming down. And so on Friday, the scientists were able to advise that the alert level came down. So we are on plan. We'll, of course, be setting out more details of that plan. And in the plan, it states that on around July the 4th, we will take further measures if it's safe to do so.
And what could those further measures be? I'm asking because there's speculation, obviously, in the papers today that we're talking about UK staycations, we're talking about hairdressers, pubs. What could the next steps be?
Well, we talk about hospitality and outdoor hospitality in that plan, but there are a whole series of other services, especially those where you need to be physically close to somebody in order to carry it out, like a haircut. A lot of the country does need a haircut. We need to do that in a safe way. And so it's both about what safely can be reopened, but also how we do that in a way that minimises the rate of transmission. The way we think about it is this: how can we get the best possible positive impact for people's lives and people's livelihoods, for the economy, subject to always keeping it safe, and the safety has to come first. Nobody wants to see the number of cases increase, and instead what we want to do is use local action to target clusters and outbreaks when we see them.
Just to be really specific then, because as you say, lots of people do need a haircut at this point, could we be going to the hairdressers on July the 4th?
Well, I'm not going to rule that out. I'm not going to rule that out, but we'll set out the details as soon as we can. And what I'm trying to do is set out the principles behind the decisions that we'll take, and we'll set them out in a rigorous and formal way. But you can see the direction that we're going, because we set the direction out in the plan that we published last month, and we are clearly on track for that plan because the number of cases is coming down, and the plan does refer to hospitality and some of the other things that are closed that so many people want to see open.
One thing, of course, that lots of people want to see reopen is pubs, but the drinking experience could be a bit different. There's talk about potentially ordering through an app or having to register before you go to your local pub. What kind of things could we see?
Well, that is the sort of thing that we're looking at for how do you make it safe to open things, and more importantly, as safe as possible to open as much as reasonably possible. And that's the approach that we're taking. It's actually the approach that many other countries around the world are taking. And things like wearing a face mask, which reduces the transmission very clearly. about how the seating is arranged, because face-to-face is much more dangerous than back-to-back, and there's more transmission than side-to-side. And also the sorts of things that you can put in place, as you mentioned, to strengthen test and trace, because the whole approach is to move as much as is safely possible from a national lockdown towards targeted local action where we see an outbreak. For instance, this.
So just specifically, you could have to register effectively, sign up before you go to a pub.
Well, I wouldn't rule that out. It isn't a decision that we've taken yet, but there are other countries in the world that take that approach, and there's a reason for it. And the reason that they do that is that you can then, if there is a positive case, and now there's only a few thousand positive cases a day rather than the many tens of thousands that there were in the peak, then you can go and trace the people who were at risk of being in contact. That's the approach that's working through the test and trace process, and it's an approach that's being used in other countries as well.
Of course, it's a really difficult time for the economy, even if things are starting to gradually reopen. Revenues apparently down around 40% of normal levels in shops. Is the Chancellor considering a cut to VAT?
Well, that is absolutely a matter for a budget, and you wouldn't expect me to comment either way on any speculation on what's in a budget. It's very much a matter for the Chancellor, and it's very much a matter for a budget.
Okay.
But the broader point's true, right? Which is that the economy has taken a terrible hit, and we need to get it back on its feet and give people the confidence to get out there, and we can see that things are improving. We can see the virus is increasingly under control. There is more work to do, and we must keep it down now that we've got it down. But we must also have the confidence to restore as much of normal life as is safely possible. That is the normal things people want to go back to. For instance, being able to shop.
The key thing, of course, if you do want people to shop, to spend money, to help get the economy moving again, is to convince people, as you say, that it's safe to do so. And a big part of that is having the contact tracing system up and running. So as soon as new outbreaks of infection are identified, they can be clamped down on quickly. And I just want to have a little look about whether the system is working as it should. Because in the latest week, for what we have stats for, 4,300 people who tested positive for COVID-19 were reached by the test and trace system and asked to provide details of their contacts. So that's 4,300 contacted every week. But the ONS estimates that 4,500 people get coronavirus every day. Why are so many people not being reached?
Well, the number one thing that we need people to do is, if you have symptoms, come forward for a test, because that ONS survey, which is the best survey that there is of the extent of coronavirus, also finds that between 70 and 80% of people, so around 3/4, don't have any symptoms at all. So they don't know to come forward for a test because they don't have symptoms. That is at the heart of the challenge of this virus. It's a natural thing of this virus that makes it so difficult to control that many people who have no symptoms at all have the virus and can transmit the virus. So that's the main reason. Now, of course, the stronger the test and trace system gets, the more of those people are reached because they've got it from somebody, and the more people who are tested positive out of the total number of people who get coronavirus, the better we will get at being able to control it. So this is why it's so important that if you are asked to isolate by NHS Test and Trace, then you must do so, because that then breaks the chain of transmission. And at the same time, we go in with local action in places where there's a cluster. And we've talked about some of that this week. For instance, there's been a couple of manufacturing facilities in Kirklees in Yorkshire, and we're working in Leicester, where we've got a challenge, working very closely with the local council, the local director of public health.
At the same time, from your answer, it seems pretty clear that finding the contacts of these people is absolutely critical to the system working. But a subcommittee of SAGE, the scientists advising the government, said back in April, a successful contact tracing strategy would require around 30 contacts to be tested per symptomatic case. Beyond that, the benefits would be marginal. But the latest figures suggest just 10 contacts are being identified by positive case. Why is that happening?
Yeah, so the difference between those figures is because of lockdown. So for those people who test positive, who are in jobs that require them to go out and work in a normal way, we're seeing around 30 contacts per person. But a lot of people are in lockdown, and they tend to only have 3 or 4 contacts themselves. So that advice was based on analysis when there isn't a lockdown. When there is a lockdown, the number of contacts people have comes right down.
It was the 20th of April, so it was during the lockdown.
I know, but I know that paper, and it's based on analysis of what happens during when there isn't a lockdown. And the point I'm making is that part of the purpose of lockdown was to reduce the number of contacts that people have, and that has happened. And so and so there are fewer contacts to trace of the people who've tested positive, and that's a good thing because it means that the virus has had less chance to spread onto other people. And I'm just delighted with the early performance of NHS Test and Trace. It has performed really well. The vast majority of people are engaged with it. The vast majority of people are isolating, say that they'll isolate when they're asked to. And this is, there are now over 85,000 people who are isolating because of this system being in place. And so we're targeting the need to isolate at those who are higher risk, meaning everybody else can have some of their freedoms back. So it is exactly how the system is intended to work.
You say you're delighted with it, is exactly how it should work, even though it's catching less than 1 in 7 people with coronavirus. Now, you hired 27,000 contact tracers. In a week, they reached 40,000 contacts. So they're reaching less than 2 people in a whole week. Yeah. How is that a success?
So let me just pick you up on both of those points. So the first one, I've just answered this point. That there are many people are asymptomatic, and
I understand the explanation. I understand that you're giving the explanation. I understand that you're giving the explanation for it, but it's still, as you say, it's clearly asymptomatic people are slipping through. How can it be right that the contact tracers are contacting less than 2 each in a whole week?
Well, we've got a really big system in case we need it and on standby. And so this is the second point I was going to come on to. Having explained the point on your of why it's hard to find all of those asymptomatic cases and why anybody with symptoms must come forward. The second point is we built a big system, and we don't need as big a system now because the number of new transmissions is lower than it was. And that is a good thing. But am I pleased that we've got excess capacity in contact tracing? You bet I am. And I read these stories in the newspaper saying, oh, it's terrible, we've got contact tracers who don't have enough to do. Well, it is a good thing to have spare capacity in these sorts of areas. The contact tracers are doing a brilliant job. And as the number of new cases comes down across the country, so there will be less contact tracing to do. At the same time, we want to increase the number of people who, out of the actual total number of new transmissions, we want to increase the proportion who we find. And so that is why we have the capacity there. And having spare capacity in a project like this is a good thing.
OK. Now, you said that part of the contact tracing system would be an app that would be crucial to all of this and would be launched by mid-May. But after 3 months and millions of pounds, you've had to abandon the original app because it only recognised 4% of Apple phones. Now, when you launched the trial in the Isle of Wight, you said, where the Isle of Wight goes, Britain follows. With hindsight, would it have been useful to know that where the Isle of Wight was going was actually down a dead end with an app that didn't work?
No. On the contrary, we will get the app up and running. there were two different types of technology, and we know that the app that we used on the Isle of Wight, that works on Android phones. Apple have a part of their system that meant that it wouldn't work on their phones, and we were engaged with Apple to talk about how we could fix that problem. They, at the same time, later brought out their own version with Google. As soon as they announced that, we started working on that project as well. And now we are bringing the two together because there's problems with their app in terms of how it measures distance. There were clearly problems with ours because there was a bit of it worked on Android, and Apple wouldn't make the change that was needed to allow it to work on Apple. So we're engaged with them and with Google to have a system that works and gets the best from both sides. But I'm really glad that we went down both routes. As I said on Thursday, that we rode both horses, because it means that we can now bring together the best of both. Of course, I wish we'd brought it in sooner, because I wish that we'd been able to. Apple had, made the change that was needed for it to work on Apple phones in the same way that the original works on Android phones. But we will get there.
I mean, I can see the kind of the frustration, if you like, that Apple didn't make the change that you feel that they could have. And, I accept, perhaps Apple weren't as helpful as you would have liked them to be. But what I don't understand is why this wasn't picked up earlier. I mean, it only recognised 4% of Apple phones. I mean, this isn't like a marginal difference. This is a huge number. And on the 10th of May, for example, Dr. Michael Veal told this show, the problem is that Apple and Google, Apple in particular, have said that the app doesn't work with their operating system. And so the UK is really going against the grain, and therefore it's finding problems on both Google and Apple phones. He says he first warned the government about this on the 11th of April. So I just don't understand. Why didn't you just listen to them? Why didn't you admit defeat earlier?
Yeah, I've seen this point being made, and there's a really simple answer to it, which is the moment that Apple and Google brought forward their technology, we started working on that as well. So absolutely, it's a perfectly reasonable point that people make, which is that Apple have in the past also been intransigent in the face of perfectly reasonable requests from democratically elected governments to work with them on solving particular problems, whether that's about solutions to terrorism or other technical problems. And so absolutely I understand that reluctance on their part. And to be fair to Apple, they may have good technical reasons for it, because which are under the skin of things. As soon as they brought forward their technology, we immediately started working on that. That's why I say we rode both horses, and that's why I'm highly confident that we will be able to get there, and we're working on that right now.
Just very quickly, when are you expecting the app to be ready?
Well, I'm not going to put a date on it, and the simple reason is that we don't have a launch date, and until we do, I'm just going to work hard to get it as soon as possible.
But it will happen.
Well, I'm highly confident it'll happen, but
okay.
Given my experience over the last 3 or 4 months on this one, I'm not going to put a date on it. We're just working incredibly hard to make it happen.
Okay, and just very finally, looking back at the last few months, the government's record on dealing with the pandemic, the UK's got the highest death toll in Europe. The OECD says that we will suffer the largest economic hit of any major economy this year. We're behind many of our neighbours on easing lockdown. How can it be that we look like we're going to end up with a higher death toll, a longer lockdown and a worse economic hit? How has that happened?
Well, there'll be a time for this sort of analysis, and it's very important in terms of ensuring that all the lessons are learned. And there's lots of potential reasons for that, including just how open a country we are and the amount of engagement that we have around the world. But naturally, you'd expect that I focus and spend all of my time focusing on the future and what we do next to get the economy open as much as is safely possible, and to make sure that we keep the virus down now that we've got the rates of transmission right down.